As part of the new year, uh, health and fitness feature as one of the top goals for most people. In the last decade, a growing trend has been to look at alternate medicine. And a lot of people are either dissatisfied with the conventional medicine system or they feel that it has a lot of side effects. People have also been wondering about a holistic area in which not just the symptoms are treated, but the whole individual is treated. So on and so forth. We have gone ahead and you see a plethora of advertisements on social media, on Instagram about and Facebook about the kind of supplements, herbal supplements and teas and other things people can take. While I was looking for this, an old friend, an old ex-colleague actually happened to talk about the kind of work that she is doing. And I decided to have her feature as our next guest and WonderWoman on the WiP platform. This is Meru Parmar. Welcome, Meru.
Thank you, Dr. Mandeep.
How are
I'm really
you?
happy to be here.
Yes, I must tell people that Meru is a ex-banker. She's a former banker and is an artist. And I've always been thankful to her because during my chemotherapy, she was the one who taught me how to hold a brush and do some. And that art therapy, I think, helped me a lot to calm down and be part of my treatment. And Meru, I always thank you for that.
My honor.
So Meru is a consultant medical herbalist based in Ontario, Canada. So I know we have woken up very early this morning. Her expertise lies in functional diagnostic medicine, focusing particularly on chronic illnesses, autoimmune issues, and women's health. She graduated with distinction as a medical herbalist from Heartwood Education. It is a professional 4-year herbalist course, and it has been accredited by the National Institute of Medical Herbalist based in UK. So I just wanted to say this before we start. And I know you for so long, and this seems to be the right choice in so many ways. Meru, how did you choose to be in herbal medicine?
Mandeep, actually, herbal medicine chose me. I'm a retired banker, as you know, and I was an artist, but I was still searching for a purpose for the next phase of my life. And I encountered herbal medicine as an experience. And I had my undergrad degree was in BSc Botany honors, so it came back a full circle. And I enjoyed my last 4 years of studying herbal medicine thoroughly.
Oh, tell me something. What can a person expect when they visit a medical herbalist?
A medical herbalist consultation is typically 60 to 90 minutes. We are looking at the person completely. We are looking at the issues they're facing currently, but also their past medical history, their family history, their lifestyle, diet. So we're looking at the complete person. Like Hippocrates says, what is more important is to know what person the disease has rather than the disease a person has. The same condition can affect different people, but everybody will react differently to it. So it's important to understand the terrain of the person.
You know, I was just saying it earlier that there's so many advertisements about the kind of supplements, herbal supplements which are available online or teas which are available. How can a person who is, I mean, doesn't know much about these things know what is safe? So, what is safe in herbal medicine is the question that I keep asking myself.
It's there are supplements, but the dosage at which you take a certain herb for a certain condition is important. So that's one point. Anything which is in its natural form, herbal medicine is for the people and of the people. There is no separation between the plants and us. There is no specific process which needs to be done before we can use the plant as medicine. However, knowledge of what ails you, a proper diagnosis of that is important in case there is a serious underlying condition which is masked, and also understanding of which herb is appropriate for which ailment. So, if there is something serious and chronic going on, it's always a good idea to consult a herbalist, to consult a practitioner who uses plant medicines. However, for our day to day acute issues, self limiting infections, a kitchen cabinet is a great place to start. And there are a lot of wonderful YouTube videos and resources available to educate yourself.
That's true. So, is herbal medicines evidence-based?
That's the favorite question of my medical practitioner friends. I always get asked that. Yes, there are enough and more double blind, placebo controlled random trials. However, let's not forget that 60% of the pharma medicines are derived from the plants directly, and pharma is constantly researching plants for more and more cares. However, there's another point I'd like to bring in here. We are complex, living beings are complex, we are complex. Our medicines have to be complex. A synthetic drug is a single compound acting on a single pathway in a human body, whereas plants have multiple constituents and they act on us through multiple pathways. And I think science is limited at the moment to be able to completely understand and model these multiple variables.
Yeah, I guess so. Would you, in the beginning, recommend people, because a lot of people would say that, can I take it along with my, my medicine that I'm currently taking, which could be for important ailments, and they do not want to totally, they want to supplement it or complement some of those things rather than, I mean, do an integrated medicine style rather than go solely on herbal medicine. Are you okay with living with that?
Absolutely. As medical herbalists, we train in orthodox medicine as well. We study anatomy, physiology, pathophysiology. Then, on top of that, we study phytochemistry, and we study herb drug interactions. So, we are trained to understand the pharmaceutical medicines as well and how our herbs interact with these pharmaceutical medicines so that we can prescribe them safely and we are able to discuss it with your practitioner if needed, what the effect of herbs is and how it's contraindicated or works well or supports the pharmaceutical medicine.
So two questions are coming to me. You said that, you do a complete diagnostic. So when you go to a normal GP or anyone, they usually get your blood work done and other things done. So when someone comes to you, do you also get into their total medical history and understand each of these things?
Yes, absolutely. If we get some blood work, that's amazing. We are always happy to look at it. So, yes, we are able to look at a person, we are able to read the blood reports, we are able to look at the scans. They do help us looking at the person as a whole.
Oh, so is there a little thin line between how Ayurveda people say that we also use herbs and other kind of oils drawn naturally and a medical herbalist? Is there something common between them?
Absolutely. Ayurvedic practitioners and medical herbalists, we both use plants as remedies. However, Ayurveda is a little more complex, or shall I say, their remedies are way more complex. They also employ minerals and metals and stones as part of their therapies. They also have different therapeutic methods like the panchakarma, and their energy, and they work on the energetics and constitution of a person. Whereas medical herbalists, we have a little more of the conventional medicine in terms of looking at the body. Um, and I think the main difference would be that we have a very strong knowledge of the herb drug interactions and hence are able to safely prescribe alongside the pharma drugs you may be on for chronic conditions.
Lovely. So what conditions now, because majority of the people who come to know and people would want to know, all our members would want to know, the what conditions can herbal medicine help? And if you can share some specific examples, that would really help.
Absolutely. So, herbal medicine can help any and every condition. However, it's really effective in a space where there's an effectiveness gap in modern medicine. For chronic health issues, herbal medicine can bring the body back into the balance gently and safely. We believe in the body's innate ability to heal itself and correct the imbalances, and herbal medicines gently support the body in that process. So, some of the typical conditions where I would think herbal medicine is supremely effective is arthritis, different kinds of arthritis, or if there are hormonal issues, or if there are issues with the gut, or allergies or immune system. These are areas where herbal medicine can really shine.
Increasingly, although people are living longer lives, and we have been talking about it, I think the stress, the sedentary lifestyles, and everyone, the lifestyle diseases, people keep talking about it. And in fact, things that we didn't know when we were younger about sensory overloads or panic attacks, they're so common in younger people. So there is a large part when people are talking about mindfulness and meditation and things like that. But if people could also, increasingly people talk about naturopathy, and I think this is a new line that one didn't know about, and I'm so glad I found you back, Meru, doing this, and that we can really look forward to some of our people and going and talking to you and finding out which is the way forward. Tell me, when do you know, like we always tell people, when you are a coach, a leadership coach, then when do you know that a person has to actually go for therapy? Similarly, I will ask you that, you are a medical herbalist, but when do you know that person should actually go and see a medical doctor?
Absolutely. Conventional medical medicine is brilliant in the areas of acute medical care, in terms of emergencies. In case you need a surgery, you should definitely not come to a herbalist. You should definitely go see your orthopedic surgeon. However, once your bone is set, do come to a herbalist because we can support the strength and quicker recovery of your bone. Or, for example, if you're diagnosed with cancer, definitely see your oncology surgeon. But things like chemotherapy and radiotherapy can be wonderfully supported by herbal medicine. In fact, Mandeep, we've had cases where a patient is not able to take chemotherapy and has had to stop chemotherapy. They come to a herbalist. We are able to support their bodies so that they can go back and finish their chemo regimen. So, herbal medicine can be really supportive. I think increasingly we are looking at medicine to be effective, to put the patient in center, and all the practitioners integratively hold hands to support the patient's health and patient's desires. Lifestyle medication is another area now because most of the diseases which people are now living with are caused due to the lifestyle, like you mentioned, due to stress, sedentary lifestyles, our dietary choices because we are always on the run. So, lifestyle medication is also now playing a bigger and bigger role in helping people move back to health.
How about diabetes? How about menopause? I mean, are these things that someone can come to you? I mean, this come to my mind because these are things that I think some of
Yes.
us I'm facing right now.
Okay, so let's talk about menopause. During your perimenopause and menopause, during your late 40s and 50s, we go through a process where naturally the estrogen level starts to come down. And menopause is the symptoms of menopause are showing an adjustment to this change happening. And it's not just estrogen, the entire plethora of hormones are changing. The progesterone levels are probably earlier to fall than estrogen and leads to longer bleeds, heavy bleeds, and and even the insulin levels start to change. So these changes happen. And what herbal medicine does is it gently supports the body to manage these changes. It's not a hormone replacement therapy. We are looking primarily to the gut so that we can absorb the phytoestrogens which are there in our foods like lentils, your dals, your beans, which can be processed by the body and can be used to support the body through the change. We are looking at recommending exercise so that your metabolic health stays good, your thyroid then stays in good condition, your bone strength is maintained. So we look at and herbal medicine can also help with a slight amount of anxiety and sleeplessness, which comes along with menopausal changes. It's also very effective for hot sweats and night sweats and hot flashes.
Well, that sounds good. Logistically, how does it work? If somebody consults you online, then how do you manage to send them the medicines and things like that? Because I know you're all the way in Canada, so I'm just wondering.
Yes. So till now, what we've done is when I see patients which are overseas, I will recommend herbs which are available in the local market, and I can usually give links. But my first point of stop is your kitchen cupboard. All the wonderful herbs and spice, well-stocked herbs and spices kitchen cupboards in India are amazing to start with. And then there are other plant materials which we can source locally. Sometimes we might rely on supplements and capsules to support us.
That sounds lovely. I mean, I didn't know that they can come out of our kitchen cabinets. Wo dadi ma ka and nani ma wala tricks,
Okay.
you know,
Yes.
in this case.
Uh,
That's
yeah, Mandeep, herbal medicine is thousands of years old.
right.
Pharma is a 19th century medicine, but our ancestors have always been in communication and have known how to use these plant medicines. And not just us, all living forms, even animals have the intelligence to be able to go and find their own medicines in nature.
Whether you went into mythology, Hanumanji going and getting something from for Lakshman, or it was any Chinese things or any one movies that you see, you always see them crushing something and giving herbal medicine. Now I'm thinking about, I'm a movie buff, so I can relate to where herbal medicine comes. Thank you, Meru. That really gives us a lot of perspective on the world of herbal medicine. One last question I usually love to ask my guests: what is your success mantra?
Mandeep, Buddhist meditation has had an influence on my life. So my success mantra is impermanence. Whether our lives are long or short, one thing is certain that we all have to leave this world. So why not live our lives fully, guided by our hearts and our moral compass, so that we are at peace and we spread happiness and joy wherever we go every day.
I thank you so much. That's really true about you, actually. I was just telling Devyanshi before you joined us in the call that you're one person I have known who has lived her life with so much grace and elegance, and you always, there was so much peace on your face, Meru. I used to always tell everyone, and I think it's all because the way you have lived your life. Bless you. And wishing you you and your husband and your daughter, a fabulous, fabulous 2025.
Thank you, Dr. Mandeep, and wishing all the viewers an amazing and healthy 2025 as well. Thank you for this opportunity.
Bye bye.
Herbal medicine's view on arthritis is that we look at bones as rivers, and joints are the bottlenecks, which is where some toxic substances can get stuck and then start to cause issues. So, the way we address joint health is by supporting the kidneys so the mineral balance is maintained. And typically, it happens in old age because our stomach acid goes low. Like when we are young, we make about 2 liters of stomach acid. By the time we are in our 30, 40, our stomach acid is only about half a liter. So we can't metabolize calcium properly, and then certain kind of calcium crystals go and sit and cause osteoarthritis as we age. And if we just support the kidneys, it can actually dredge it, and blood can dredge it and move it out of the body. And you can recover, if there has not been a complete degradation of the cartilage, you can recover from even things like osteoarthritis.
My God, that's
But
lovely.
but there are many kinds of arthritis, Mandeep, like 20, 30. They keep adding new ones, things like rheumatoid arthritis or ankylosing spondylitis. These are more autoimmune issues where either some kind of stealth infection in your gut is leading to this molecular mimicry, and therefore it's attacking. So we will make sure that there's no stealth microbes in your body. We will look to obviously give relief from pain and inflammation, and certain herbs like meadowsweet, which is what they made aspirin, which was the first drug, was from spirea. Spirea used to be the botanical name of meadowsweet. And so we will give herbs like that to basically reduce the pain in the joints. But we will again work from the gut. There are enough and more studies which tell us if your gut is okay, your inflammation of your rheumatoid arthritis goes down. So we work on the gut to support the autoimmune issues. And instead of putting people on things like methotrexate, when people come to me, that's a chemo drug, and people are put on it for rheumatoid arthritis. Suppressing the immune system um, is not probably the best way to go. You should suppress the cause which is causing that immune reaction, because the immune system is there to protect us.
Absolutely.
Hi, I'm Meru Parmar. I'm a medical herbalist, and you can reach me through my website, which also has my email and phone number.